A new report claims more deaths are now linked to suicide among people ages 35 to 64 than motor vehicle accidents. The Centers for Disease Control study found a 28.4% increase in suicide rates since 1999. For women in the age group, the rate increased 31.5%, while men committed suicide 27.3% more than they did a decade earlier. Firearms remain the most used mechanism of suicide, but there were marked increases in poisoning deaths, up 24%, and suffocation, such as hanging, up 81%. The study highlights a few possible explanations for the increase, including the recent economic downturn, a cohort effect, citing the baby boomers' higher rates of suicide as adolescents, and easier access to opiates like OxyContin. The CDC report mentions that most prevention efforts are focused on youths and adults older than 65, and this study should reveal the importance of prevention for middle-aged Americans. The New York Times points out the CDC's numbers may even be underreporting the issue. Suicide rates can be difficult to interpret because of variations in the way local officials report causes of death. While reporting of suicides is not always consistent around the country, the current numbers are, if anything, too low. As for economic strain as a factor for the increase, NBC News drew a comparison between the present and the Great Depression. The peak rate of suicide in 1933 occurred 1 year after the total U.S. unemployment rate reached 25% of the labor force. At the individual level, unemployed individuals have between 2 and 4 times the suicide rate of those employed. A psychologist told the Milwaukee Journal-Sentinel that expectations in baby boomers' lives may lead to depression, thinking they were set for retirement, but then losing their retirement investments and having to contemplate working for the rest of their lives, or losing their jobs and having the stress of supporting both kids and elderly parents. The CDC study says suicide rates remain nearly unchanged for youths and people older than 65. For Newsy, I'm Megan Murphy. Multiple sources, a broader view.